recumbency restraint. So we start with the sitting position, and then we carefully place in the lying position, just like we've discussed in the previous slides. And then you want to hold the legs down on one side and sweep them to another side. All right. So you have to be able to pay attention to the dog's head, because the moment you sweep the legs onto one side, it's likely that they're going to hit their head on the table. So you want to make sure that they don't. Right? So here you go. Here's the video from the lying position. If you notice, the dog is already preferring one side, so it's just a matter of being able to slide the forelimbs onto the other side of the table so that it's in the lateral position. So again, see this video, you have the right side, right forelimb of the dog being held by our orderly, and it's slid down so that all four limbs are on one side, making her lie on her right lateral position. So there you go, slide, watch the head, there you go. So you see his arm catches that head so that she doesn't hit or bump her head on the table. And then he holds on to the hind limbs and forelimbs with one hand each to be able to restrain her into that position. Again, up, there you go, he hits the table. If you don't have your arm there, the head hits the table. If you don't have your arm there, and then both legs held by one, both hind legs held by one arm, and both forelimbs held by another hand. Okay, now we do the dorsal recumbency restraint, or basically you want the dog to lie on its back for whatever reason, right? So you will need at least two people to do this. So you place the dog on the lateral position, then you want to roll the dog over so that it lies on its back, and then you pull the forelimbs forward towards the head and the hind limbs slightly back, right? So let's look at the video. So there you go, from the sternal recumbency to the side and to the lying on the back. So let's watch that again. Okay, sternal, lateral, roll. Okay. All right. So with cat restraint, again, as I mentioned earlier, cats, you have to watch over the teeth and all four legs. But restraints are fairly similar, except that you don't usually wrap your hand around the neck, because that gives your cat free hand or free legs to move about, and a cat's head is a little bit more agile, a little bit more nimble than a dog's. So usually the best way to control control a cat's head is by scruffing. So basically you want to use your dominant hand to scruff the cat, which is basically you want to grab a large portion of skin right at the back of the cat's neck. That's the scruff area, and you want to scruff that, or it's called scruffing. Hold on to as much skin so that you prevent the cat from having its head move from left to right and possibly biting the hand. That's scruffing the neck. And then you want to hold the abdominal, or support the abdominal area as you're carrying. So if you look at this picture, the right hand is supporting the abdominal area as they attempt to carry. Okay, so this is one type of restraint that isn't scruffing, but instead you have all four limbs, the forelimb and the hind limb, all four limbs tucked into the restrainer or the person restraining, and then the other hand holding on to the neck, right? This type of restraint is good enough for the cats that aren't feral, or the cats that are a little bit docile. But if you have a bit of an aggressive cat or an untrusting cat, you do not want to do this procedure. But if you look at the pictures, you'll see the elbow area is applying pressure on the hind limb, while the hand of the same arm, so this is the right arm with the elbow area tucking in the hind limb, keeping it close to the body so that it cannot move, and the right hand holding on to both forelimbs. So basically, it's your right arm that's restraining the whole four legs, and the left arm or the left hand restraining the head area. Okay, scruffing. This is one of the more easy techniques to restrain. Alright, as I mentioned, you get a large portion of skin at the back of the neck of the cat. Grab and pull up so that it prevents the cat from moving its head left or right. Okay, let's look at that again. So grab the skin, and then you have the cat, you stop the cat from being able to move left or right. Now note, if you do not grab enough skin, the cat will be able to do a 45-90 degree turn and bite that hand that's holding on to that scruff. So it's imperative, or it's very important, that you're able to grab as much skin to prevent the cat from biting you. If you don't have enough skin, then let go, grab again. Right? Also, if you notice on this video, let's take a look at that again. Scruffing is almost a natural restraint technique with cats. See, the moment you scruff, they have this innate feeling that they have been restrained. So again, even without full pressure, you'll see our orderly, the moment he grabs that scruff, cat crouches down. See? So scruff, crouches down. So it's very important to realize that scruffing innately makes the cat think that they've been incapacitated. Right? So there you go. Oh, we've done that. Okay, so this is the scruffing cat restraint. So again, we have your scruffing, grab, and then you want to be able to restrain the cat for a procedure, so he grabs all four legs underneath and tucks it close to his body. Similar to the previous slide, let's do that again. But this one holds on to controls the head, or holds on to the neck by scruffing, and then grabs the legs, secures the legs by tucking underneath, or tucks the legs onto his body. Okay. Sternal restraint. So basically what you want to do is, again, still control the head to prevent any bite, and control all the legs so that they don't end up scratching you. So how do you get the cat to do a sternal restraint? You have the cat standing on the table, scruff the cat with one hand, then the other hand gently pushes the cat into a rear position, and then you lean over the cat's back to slide it into a sternal position. Right? So basically, you're just forcing it to lie down. But in a sternal restraint, if you're going to put pressure on the hind area, the scruff area, you want to be able to put some pressure on the back to make sure that it cannot move its leg at the back, and it cannot move its leg at the front. If you don't put enough pressure on that, they're going to be able to get off or be able to escape your restraint, and they're going to start scratching you like crazy. Right? So let's check our video with our orderly. There you go. Scruff in front, pushes down. Okay, you see that? So he scruffed, the cat automatically crouches. See that again? Crouches, and then he just puts a little bit of pressure, and you have the sternal recumbency. But note on this video, the cat's right forelimb is not quite flat on the table. You prefer to have it flat on the table, because if it has having that position where it's slightly bent, when you put pressure, it can either be more painful and it will thrash about, or it will have create more resistance. but at the same time, it also puts them at a more flexible position where they can move or they can more easily get away from your restraint. You want to be able to do this type of sternal restraint wherein all four paws are facing the table or the ground. All right. Lateral recumbency. All right. So you again scruff and one hand holding the hind leg. Right. This is a restraint picture. That's all well and good, but what's the problem with this picture? Your forelimbs are free to move, and if you have an unruly cat, a feral cat, or an aggressive cat, that cat's gonna scratch you with those forelimbs. So you may need to ask for someone else to assist you just to hold those legs, or some may grab all four legs with one hand if they have a big enough hand. So it really would depend. Okay, so how do you get them on the lateral side or lateral recumbency? You put them on the sternal recumbency first, scruff the cat, then slide. Okay, so there you go. Okay, proper way of carrying or lifting the dog. As I mentioned in one of the very first slides, you want to be able to carry on the hind leg, at the back of the hind or the rump, where most of the weight is, then one arm on the chest area. All right. Okay, proper way of carrying a cat. So you can do a scruffing, scruffing, but for the more docile cats, you may want to carry them with one arm supporting the rump area and the other arm wrapping around the chest area. Right? Okay. Equipment. So what are your restraint equipments? There are times when you don't have a choice that you may have to use restraint equipment for severely aggressive dogs or cats or the ones that are feral, strays. So you may need to use some equipment. The most common is the control pole. I'm sure all of you have seen the poles that hounds carry in movies, how they catch stray dogs and possibly stray cats. So that's one, the control pole. There you go. With cats, it's usually a pole with a net, kind of like a butterfly net that helps catch those stray cats. So you have that loop that closes as you put the neck through that little loop there. With cats, you can do it that way, but it's nowhere near as effective as in dogs. The net is usually easier. So you have protective gloves, all right? Protective gloves are more commonly used with cats or with exotic wildlife animals. Not commonly with dogs. They prevent scratches, some bites. So you have protective gloves. Personally, I prefer not to use protective gloves because they usually don't give you as much of a grip or a more solid grip when you're restraining the animal. So, but it does protect your hand from scratches. It does protect to some degree from bites. Okay, all right. Muzzles or tape muzzles. Okay, these are the more common muzzles or busal. All right. So basically, you have the muzzle to prevent biting or to prevent the dog from biting the person doing the procedure. An improvised muzzle for cat is a paper cup or a styrofoam cup with a tie. Sometimes it's a mask. Usually muzzles for cats are full cover masks. With dogs, sometimes they do an improvised muzzle. We used to use shoelaces when we were in school to make a sort of tape muzzle. Okay, so this is an example of how you do a tape muzzle or how we do the shoelace. Imagine this gauze to be a shoelace. So you do a loop with a twist, similar to if you were tying a shoelace. You approach the dog and then you put the muzzle or the mouth area through that loop and tighten it, and then Since some would go through looping it underneath on the lower jaw and then wrapping around the back of the ears. Okay, see, there you go. So underneath, and then you go through to the back, to behind the ears, and then you tie it like a shoelace. All right. You have to be able to make sure that that you don't tie it too tight, because it's going to start to swell. It's going to start to get inflamed. It's very uncomfortable. So you should have the just right amount of pressure when you use one of these types of muscles. Okay. Okay. So there you go, cat muscles. So as I said, it's a full face mask, covers the eyes. Usually covering the eyes helps as a restraint as well, because at least you don't have visual stimulation. They don't get anxious or they don't get nervous by things moving around them. So it does help as a restraint technique or a restraint tool, just like the table is a restraint tool when dealing with dogs. Okay. So it also restricts the movement of the jaw, so it cannot do a direct bite on whoever's handling or doing the procedure. Okay, towels and blankets. These are also kind of restraint equipment. Usually with cats, you get a towel, you wrap them around, or blankets. You can also wrap them around, but crucial point to this is you need to be able to snugly fit the wrap around. If the towel is loose, they're gonna get away. If it's not quite as snug, one leg is gonna get out and it's gonna start thrashing about, and you're gonna have to let go. So it's imperative that you get them really snugly or tightly fit onto the towel, and not just a loose towel around the body. Right? You can also use restraint bags. If medyo sosyalin or you're a bit well off, you don't want to do with a towel, you want it a little easier to deal with, you can do a restraint bag. But again, it's important to have the right size of restraint bag. Too small, cat won't fit the restraint bag. If it's too big, your cat will be able to move around and it's going to destroy your cat bag. You have to have a snugly fit, correct sized cat bag. Alright, this allows easy access. The cat restraint bags are perfect for blood collections. It ensures safety and handling for yourself and allows medication to be given. Alright, so sizing for cat bags. Alright, so again, as I mentioned, it's very important to get the proper size. Sorry, the volume's still in. So it's very important to get the proper size of restraint bags. Any bigger and it's going to be ineffective in restraining. Okay, so let's see. Alright, so you're gonna see them scruff, grab, push them down into sternal recumbency into the bag. First thing you usually want to do is wrap that Velcro, wrap that area where the neck is, and then just push down the body while getting that bag closed up. So in this case, if you notice, the assist was a little slow in closing that collar or that neck area of the bag. So they should have decided to do the wrap around on the neck so that they can proceed with closing the bag. Alright. So exposing the leg in the restraint bag. Okay, these little restraint bags usually have a sort of zipper where you can like just grab a leg so that you can do blood collection or administer any IV medications, possibly intramuscular medications as well. So there you go. Just a word of caution with these. If you notice the way he pulled out that leg, As the cat is comfortable, not a problem. And then when he insists on pulling out the leg, he doesn't really mind. But once he starts pulling at it, the cat's starting to complain. So that means, that there's something painful. In this regard, chances are what was giving discomfort to the cat, what was his right hand pressing on the paws. It was too firm, it was too much pressure on the paws, and that's more likely the reason why the cat started to complain. See? Because right before that, he was pulling out. See, there's no problem until he started pressing down further on the paw. Alright? Hey. There are other methods of restraint, chemical methods being one of them. We've been dealing with mostly just non-chemical methods. So sedation is a chemical method, which we prefer not to do. We almost never do a sedation restraint or a chemical restraint unless it's for surgery. So if you have a trauma patient, a dog fight, or a patient that got bit by a dog or got into a dog fight or got hit by a car, and we need to wound clean, it's not practical to do a restraint and do a wound clean because you know that it's going to be painful, and the cat or dog is going to go crazy once you deal with the wound. So you're going to have to do sedation, you're going to have to do a chemical restraint. Okay, so remember, the least restraint is often the best restraint. If you can manage a procedure without any restraint at all, that's even better. We have had patients that will thrash about, will resist every single type of restraint, but a simple treat while doing a procedure makes him very docile or makes him very amicable to any procedure you want to do. So really, sometimes it's a case-to-case basis. You will have to gauge what procedure or what restraint technique is best for each patient. Okay, so golden rule, treat each patient how you wish your pet to be treated. Okay, so that's it. We will expect you to take an exam or a quiz to make sure that you are listening and that you understood the whole lecture. Thank you.